All right, please start. Godfred,
Hello, Doc.
yes,
Oh,
please
sorry.
start.
Okay, I'm the one to start. Okay, I thought it's the other lady. Sorry.
No,
Okay.
did you
No,
go
no,
through
no.
it
I
at
can do
all?
it. I can do it. Let's go. I didn't hear you. That's all
Oh,
right.
okay.
I can do it. Okay, let's go. Good evening.
Good evening.
My name is Godfred, one of the nurses in this emergency department. I'll be taking care of you this evening. Is that a convenient time to do so?
Yes, it's fine.
Okay. Before we proceed, could you please tell me your name and your date of birth, just to cross-check the information I have?
Okay, and I'm Christopher Anderson. You can call me Chris, and I'm 45 years old.
Okay, Chris. Thank you for telling me your name. Chris, have a seat.
Yeah.
Could you please tell me what you are going through, the kind of symptoms you are experiencing?
Well, I've been having these distressing symptoms of breathlessness, and it kind of makes me feel as if I'm not getting a good air, you know what I mean? And it's associated with chest pain, and my heart keep pumping and shaky, sort of. I really don't know what is going through.
Oh, I am really, really sorry about the symptoms you are going through. And then we do acknowledge that, and I can see how difficult it is to be anxious about this kind of symptoms you are going through. But I would like to let you know that in this situation, you need to calm down, take a deep breath, and relax. And then that will help you to ease a bit of more anxiety. Is that okay with you?
Well, I do, just that I'm kind of really concerned about the medical staff. It seems they're not doing anything to treat me at all.
I totally agree with your concern. However, I just want to let you know that the medical staff are doing everything possible to make sure that the situation you are going through is resolved. Currently, the doctor has requested a test, one, which is an ECG, electrocardiogram. It's a test that is done to assess how your heart is functioning. And then the doctor also has requested for your blood pressure to be monitored. And then lastly, the doctor has requested a blood test for you so that the doctor can also see the results and know what actually is happening to you. Are you happy to hear that?
Well, to be honest with you, I'm really not happy with everything going on here. And I'm not really happy that because you're kind of calm down. How am I supposed to calm down when I'm breathless and things are not even going on with, I'm not just happy with everything. I'm even angry with you, to be honest. But it's because I just feel that I could die, or I don't know.
Yes, Chris. I can imagine how this situation seems difficult for you to cope. And then if we were in your shoes, we would have done the same thing. But as I said, the doctors are doing everything possible together with the nurses to do these tests so that they will know what actually is happening. And the doctor will be able also to, based on the outcome, to prescribe any appropriate treatment for you. But as I said, you need to calm down, sit down, take a deep breath, a little bit of deep breathing and coughing, deep breathing exercises will help you to get relief whilst waiting for the test. How do you feel about this?
Please, can you just stop telling me to calm down? Yeah, because I'm really not happy about this whole situation.
Okay. I totally I understand what you are going through.
All right, your time is up.
Okay, sorry. Okay.
Yeah, Godfred, I think your performance today is the best so far.
Thank you,
You are
Doc.
more
Thank you, Doc.
composed, although you're a little bit, your voice is still shaky, yeah, but
Okay.
your voice is still shaky. But I think today's you were more composed, and especially your intro into the whole thing was very nice.
Thank
Was
you.
very nice. Your relationship building with Tom was really very beautiful. Yeah.
Thank you, Doc.
And
Thank you, Doc.
you were able to some extent incorporate yourself into patient's perspective. Although some of the expressions you were using were not well used, the way you put them, the way you structured them, but you tried as much as possible to always try to, this is an angry patient. You try as much as you were able to be validating their concerns, validating their anger, and trying to explore more how they are feeling. That's really very nice overall. Yeah.
Thank you, Doc. Thank you, Doc. Thank you.
Okay. Yeah, Nikka, do you have anything to say?
Okay. Do I just try a little?
Do you have question or anything based on what Godfred has presented first?
Okay. Yeah, I think that was a beautiful one, but who am I to give comments here? I'm just coming for the
No,
second, but
we are
I
all
think I
here to
can
learn
see
from each
because
other.
yeah, it's really an eye opener for me, and
Yeah.
I think you went through the parameters, but regarding that referral, I didn't pick anything from there. Kind of the reassurance was was on point, but at the point of referral, I don't think that was captured.
Well, he was not able to conclude, and it can
Yeah.
happen in the exam that you might not get to the end of the task. You just have 5
Yeah.
minutes to speak,
Oh,
and
there's no
sometimes
penalty for that.
no, there is no penalty
Okay.
for that. The
Okay.
concern is to assess your
Okay.
English. Yeah. So if you're able to
Okay.
speak enough, but it's good to try
Okay.
as much as possible to complete to try to
Task.
finish. But in
Okay.
most cases, you might not be able to finish. If like this one, you have 1, 2, 3, 4, 5, 6. You have like 6 bullets here. And you have 5 minutes. And out of the 5 minutes, you're not supposed to rush your patient. The patient will speak, you will speak. That means roughly you guys are speaking 2.5 minutes, 2.5 minutes. So meaning for each task, you are not talking even up to 30 seconds. Do you understand? So you can see that the main thing is just the way he did, to some extent relaxed with the patient. The relationship building was top notch. He
Yes,
was
was on
empathic.
point.
So it
Yes.
was really very nice. He didn't rush the patient or
Yes.
trying to like cut the
Yes.
patient short or make the communication or
Yes.
make the
It was
patient more
more relaxed.
angry.
Yes.
Yeah. So
Yes.
that's him, and he was able to express himself, although his voice is still like shaky, as if he's a little bit scared. But I don't know if that's the way you talk, Godfred. Anyway, I don't know.
Yeah, that's the way I talk,
Okay, that's fine then. All right.
I
So
used to stammer a bit, but I try to overcome it. That's so sometimes.
okay, if you stammer, I think it would be nice during the exam to let the examiners know that you do. Yeah, especially during the warm-up exercise, let the examiner know that you stammer. Yeah, and
Okay.
I think that will not be a much issue then.
Okay, thank you, Doc.
All right, so let's see. Nick, I think this will be your first presentation. Let's see how you will perform with this.
Okay.
Can you see the task on the screen?
Okay, I've seen it.
All right, you have 2 minutes to go through it, then I'll ask you to start. All right, Nikka, please start.
Hello, good evening. My name is my name is Nikka, and I'm one of the nurses that works here in the coronary care unit. I don't think we've met before now. Can I know your name, please?
Okay, I'm Jeffrey.
All right, Jeffrey. Good to have you. Jeffrey, I have on my table, I have your details here with me, but in your own words, can you just tell me, because currently I'm aware that you have the diagnosis of myocardial infarction, and the cardiologist has just prescribed that an angiogram an angiogram be performed on you, which is to help us, to get a better result towards what you are experiencing. But do you have any concerns regarding that?
Yeah, to be honest, I'm really glad you came around. I've been looking for someone to talk to. But,
Oh,
but
so
you see,
good.
there is this fear. I don't really know. I'm kind of scared of the procedure. But why is
Wow.
it really necessary?
Okay, that's a good question. All right. You see, an angiogram is so necessary in this particular condition because it's such a procedure that, help us to see through the arteries that carries oxygen, to the different parts of your body. And, in the absence of oxygen, the body cannot really function optimally. So this is going to help, the cardiac team to see if there's any blockage or any obstruction at any point in time, so that they know the kind of intervention, to give you, and, it will be a gain for, for you at the end of the day. And, they get to give you the appropriate remedy towards this. How do you feel?
Okay, but I don't know. I really don't fully understand the procedure. I don't know if you can throw more light
Oh,
regarding
right.
that.
Okay, good. Now, the procedure is such that, you're going to be sedated, will make you sleep. Then, a catheter will be passed through, your lower abdomen, and it is through this medium, a dye will be passed via the catheter, so that as the dye goes by, we will know where, an obstruction. Then through a monitor, they can know where an obstruction is, if there's any. And, in history, from past experiences, there'll be very minimal, reaction or complications to that. We are aware of your allergy, really, so I can assure you that you're just going to be safe and fine. Hello?
Oh, that sounds so reassuring, to be honest. But when the doctor was talking with me, he briefly mentioned a small chance of serious complication. What do you think about that?
Yes, you're very correct. Like every other medical intervention, we could have rare, once in a while kind of complications coming in. But I want to assure you that it's just rare, But why don't you think we should give it a try?
Well, to be honest, there is this still fear about the procedure. I'm kind of,
Okay.
must it be done? Is it really necessary that it has to be done? I'm kind of scared, to be honest.
Yeah, I'm actually, actually understand your concerns and your fears, and it is expected. But I want to let you know that it is just one of the ways by which, we can get a remedy, to address the myocardial infarction, so that at the end of the day, you get better and you go home safe and sound.
Okay, I think you've actually helped me a lot, but I must say I'm not really yet ready to have this procedure. I don't know. I think I need time to think about it and then
Well,
perhaps seek some more opinion regarding this.
yeah, definitely. Why not? I mean, you have every right to, and maybe me coming up with your conclusion regarding our meeting, I can always relate to the cardiology
All
if
right, your time
you
is
know.
up.
Yeah.
Nikka, are you sure this is your first time you are presenting?
This is my first time, sir.
As in you've not had any presentation with anybody, maybe your own personal practice?
No.
Wow, this is very, very beautiful, Nikka. I'm kind of, I'm really impressed. You just followed everything the way I describe it.
And you asked me to go and listen to this, your listening today. So I listened to it.
Yeah, you really did well, as in from your intro, even the way you kind of mentioned the setting and everything. I think this is very beautiful. You made it look very real, like look very real. And this is really what is expected from you. It's more like it's conversational. Yeah. So the aspect, I think you just need to work more now. It's on your empathy. You really tried anyway, trying to make this person feel okay. But I think this is somebody that is worried and or like at that end where he was. Let me start from the ending part when he was like he really need time to. I wouldn't respond to that by saying yes, definitely you have to go. Do you get? I would leave. What if I want to respond to that? I can imagine how I can imagine that this is a tough decision to make, but you actually have the right to make that decision, seek more opinion,
Okay.
and then anything you decide will go with that. Is that okay? But we really want the best for you, all right? Do you understand?
Okay.
That's the way I would just handle it. I won't just like pop in, yes, definitely go and find. Do you get my
Okay.
points? So, and from my own perspective, that's the way I like handling it. Each point, I try to first of all throw a little bit empathy in a soft way,
Okay.
make the patient feel good. Yeah. Even you
Okay.
can even impute trying to praise the patient too. Yeah.
Okay.
So like for that, from the beginning, where the patient first of all came in and was like concerned about the distance, you can actually say, yeah, I can see this. It's not easy, and I would really commend you for coming around to even to seek more information about this. This shows that you are concerned about your health, and that means you have a good seeking behavior, a good health seeking behavior. So you also try to praise the patient at times. That's part of
Okay.
this sub points that they score you on. Yeah.
Okay.
So, but overall, I think for this to be your first presentation and you presented this way, I think you really I'm not expecting anything less than 400 and the way you are ready for this.
I think so. Don't do it.
It's okay, that's fine.
Thank you,
Yeah.
sir.
So Godfred, what do you think about this presentation really?
Doc, I am so impressed about
Yeah.
her delivery. Yes, being the first time, even though I don't believe it, but that's what she's saying. No, I don't believe it.
I just joined this class.
No, I don't believe it. What's your profession?
She just
I'm a
joined
nurse.
anyway.
I'm a nurse.
And then you are telling me you've not studied OET before, you've not heard of it before, you've not learned it before. No.
I started with him. Is the one taking me. So, but this evening
Okay.
I just finished the listening. I just finished going through his own. He gave me the link, and I went
That's
through
all right.
everything. Yeah.
Okay, that's good. That's good. That's good. You've done very, very well. But what I would say, or what I noticed was that sometimes you speak and then you forget about like asking the patient, "Are you with me? Are you happy?" Like you remember. I think one you were a bit off because you forgot to ask the patient, "Are you with me, doc?" You remember that one? And the dog was also quiet, waiting for you to.
In leading the
So
patient, to be honest, I think I really like the way he led the patient, to be honest.
okay,
She kind of, sometimes you can make like a pause to allow the patient to
okay,
come in. And if the patient is not coming in, then you
come
kind of
in.
lead the
Oh,
patient
okay.
into. So it makes the conversation more natural, to be
Oh,
honest.
okay.
Yeah.
Okay.
Yeah.
Okay.
But overall, I think she did well. I think
Yeah, she did.
she
Yeah.
did well, to be honest.
Yeah, being
Yeah.
the first time. No, it's
Yeah.
good.
Well done, Nikka.
Thank you.
All right. We have a new person. Funke, please unmute your mic. Hello, Funke. So this is where we come to the end of today's presentation. I wish you guys the best. So I really want to advise you guys or recommend that you go through my resources on that. There are a lot of things that can really help you on that YouTube, including both letter corrections, many things on that channel. Yeah, just try as much as possible to go through them. Tomorrow we'll be back again. Do have a great night, guys. Bye.
Hello, Doc.
Yeah.
I think we have a writing to be reviewed.
Yes, I've chatted you, but you're not replying.
Oh, then
All right.
then I'll chat you there. Okay.
It's okay.
Thank
Do have a great night. Bye.
you. Okay. Bye. Bye.